Hello, everyone. Hi. How's everyone? Hi, I'm Charmaine Britton. I am co-chair of Tobacco Free Jeffco. I think we may have our other co-chair, Lori Odom, our adult co-chair, on the phone. Everybody say hi to Lori. Hi, Lori. Lori had a knee injury and she's not able to be with us in person. In a little bit, I will also introduce our youth co-chair, Tasmin. But in the meantime, I'm here to welcome you, so we're very much appreciative of your presence here tonight. Raise your hand if you are a concerned citizen tonight. We got a lot of concerned citizens. Excellent. I love the under 18 sort of citizens as well. Raise your hand if you are representing the public health community tonight, or private health community. Okay, great. Raise your hand if you are representing the legislative branch, the government branch. Okay, we got one person. Okay, well tonight we're going to talk about youth vaping. Did you all know that it's an epidemic?
Yes.
This was on the news today. That says September 12th, 2018. It's now an epidemic, according to the FDA. That gives me chills, because that means that we as citizens and in the government and in the media, we have to do something about this public health crisis. And we don't know how big it's going to get, how much harm it's going to do before we can actually make a dent in this crisis, because it is an epidemic. And we've got people here tonight who are going to talk about how serious this problem is from both the professional opinion as well as the youth perspective, because that's who the epidemic is hitting the hardest, the youth, who do not understand what is happening with this incredible crisis with vaping and e-cigarettes. You pick your term, vaping, e-cigarettes, all bad for you. As we go through tonight, please be thinking about what you can do as a citizen, as a person who represents public health or the school system or the government, to make a difference on this issue. So we'll be talking about the call to action later tonight, but jot down, what can you do to make a difference and address this epidemic that's currently happening. Now we're going to talk about what's happening in the news beyond this piece right here. I'd like to now introduce my youth co-chair. This is Tasmin Duncan. Anybody hear her speak at the Lakewood City Council meeting? Wasn't she great? Yeah. Yes, she was great. She's very articulate. We're very happy to have her here. She is from Lakewood High School. She's a senior. She's part of the B team. She's very dedicated to this issue. She's got some personal experiences that make it really real for her. And more than anything, she's a go-getter. She makes things happen. She was involved in an internship this summer. So we're very happy to have her here. And now she's going to talk about what's happening out there in the news. So thank you, Tasmin.
So here are some youth vaping related headlines, and all of them are very concerning. So we have Big Tobacco is accused of using social media influencers to target us, teens. So what's been going on? Well, they're technically by law banned from targeting youth. Of course, Big Tobacco is smart, so they found a way around this. And that is influencing people who are very prominent, especially to youth on social media, these influencers, and they pay them to show tobacco in a very good, very quote-unquote sexy light for teens. So how is this being combated? Well, right now, a couple groups, including the American Heart Association, are trying to ask the Federal Trade Commission to make these posts have a hashtag of hashtag sponsored, hashtag promotion or ad, but right now this is in the air. So This is another one. A lot of the things going on with vape and why it appeals to young people so much is because it's healthier than cigarettes. In fact, a lot of people think it's harmless. Well, as the headline says, there's been lots of evidence that it's not. In fact, it's been found by University of California, San Francisco, that it actually can increase your risk of having a heart attack. On top of this, it has toxic metals in it, like lead, and a bunch of other things that are not good for you. And then, of course, you have the nicotine content, which almost all of them have, which has effects on the brain. So, not healthy, basically. So, this is specific to Colorado. So, it's been promoted as being harmless, and there has been lots of evidence, as I said earlier, to the contrary. So, why is this interesting to teens? It's got colors, it's got flavors, which really hook teens, especially. It's a gateway drug, is what this has been finding. Specifically, there was a study through this article that found that 12th grade students who had never smoked cigarettes, those who vaped, were much more likely to smoke a year later. And also, it's very prevalent in Colorado. Almost half the kids have tried vape, and 1 in 4 will do it have done it within 30 days of taking the Healthy Kids Colorado survey. So it's everywhere, it's an epidemic, and it's prominent. Yes. So, there's a lot of kids in Colorado vaping. Specifically, we're almost leading the nation in this. So, what we found is that half of kids think vaping is risky, whereas 87% think tobacco is risky, which there's a big difference between there, a 30% difference. And that's a lot of people who don't, if only half of them think that it's risky, that don't think that there's any risk involved. So again, with the Healthy Kids Colorado survey, 58% of kids say it's easy to get e-cigarettes, which doesn't surprise me. And 27% of minors right now, are using e-cigarettes. Think about that, that's over 1 in 4. In response to this trend, Colorado is trying to see a T21 law passed. For those of you who don't know what that is, that's Tobacco 21. And this has happened already in Aspen, Basalt, and most recently the city of Carbondale. There are currently no other T21 laws, though. So, another interesting and not very good development that's happened is the fact that teens are using vape products to vape marijuana. They do this by using oil or wax, which is kind of showed up there in the picture, which they can put into a vape pod. There's lots of tutorials over social media and YouTube that show you how to reuse vape or Juul products and put the oil for the marijuana into it. So now they're using it to vape pot. And this is even more concerning because the oils and the waxes have higher THC contents, which make it even more likely that it can cause psychotic episodes, issues around that. So yeah. And then finally, we have vaporware. And I think this is kind of self-explanatory. Kids are taking this into school. It used to look like a flash drive. Well, now it's literally built into your hoodie or your backpack. These products are built so that you can walk into a place and no one knows you have it on you. And it's kind of the new revolution in hiding the fact that you're vaping. So yeah, and this I'm not going to say much about, but it has been declared a public health crisis. This is something that's happening here in the now, and it is, well, as it says, it's a crisis, it's an epidemic, and it needs to be dealt with.
Thank you very much. She speaks so articulately and eloquently about this crisis and is a youth. She's living it. She sees the people in her classmates who are doing it and have no understanding of what it's all about. Yesterday, I was in my car and I heard a commercial for Juul. Have y'all heard those commercials? Yes. It's like, it makes me cringe because it just talks about it being a tobacco cessation device and blah, 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 blah. Well, this is dangerous. It's a public health crisis and we have to do something about it. So now we are going to have a presentation by Boulder County, and it's Brittany Carpenter. Brittany Carpenter, come on up. And we also have Jen Kovarik. Yes. I have Brittany's bio. She has a degree in sports and exercise with a minor in nutrition and a master's degree in public health. You know what that means? She knows about what's good for our bodies. She's been working in tobacco control for about 3 years. She's been working at Boulder Public County Health and is working in the neighborhoods, talking to people about tobacco and working with schools and talking to them about tobacco control. So we're very happy to have you here, and because we're going to get all fired up to do something about this, right?
Wonderful. Yes, thank you so much.
You.
Thank you. Yes, so I work for Boulder County Public Health in the Tobacco Education and Prevention Partnership Program. And we in Boulder County have also been working to address vaping, as it has been something that has been really prominent in our community as well. So we're really excited to be here and really appreciate getting to work with the Jeffco team and staff. It's been really great to be invited here to talk with you all tonight. So thank you all for the opportunity. I'm also going to ask that you hold questions until the end of the presentation. We have left some sticky notes on the table. If there's anything burning that comes up, please feel free to write that down. But we do have a lot to get through, and we'll have an opportunity for questions at the end. So tonight, I was really hoping that we could capitalize on the expertise in the room. I know we have a lot of folks here who have personal experience and stories in terms of vaping and what it means to you and to your community. So I thought that we could start by talking about what the current landscape is, what you're seeing, what you're hearing. I thought that I would also present some data and then close our time together to brainstorm around what we can do about this public health crisis. So I will ask a question just initially. Is there anything else that you were hoping I would cover tonight? No? Okay, great. So I did want to start off by showing a quick video clip here. Some of you may have seen this, but we'll start by watching this. Oh, do I need to? Sorry. No. No.
Now you need to use that.
Oh, now I do. Oh, I'm sorry. Not very tech savvy. Okay, thank you. No, this is great. Thanks.
Actually, reviewing the Juul. I'm excited to try it, so here we go. Oh my god, it tastes like strawberries and like it's so sweet. 5 out of 5. And I even have kind of a buzz, like I kind of feel lightheaded.
Oh, are you able to do that from where you're at? Oh.
Go back though.
Unless you're a car insurance expert, it can be hard to know what's in your coverage.
Great.
Yay. Okay. So this is a campaign called Flavors Hook Kids, and this is out of California. So I really wanted to show this to get us all thinking about vaping and really what it means to each of you. So the next question, where I really want to get into some discussion, is having you all think and reflect on this particular question. So what would you currently say the landscape of vaping is in Jefferson County? So some things to consider that I'd like you to consider when answering this question. Who is using vapes? Where are they getting vapes? What are people doing about vaping? And then what do you know about vaping? So I want to give you a few minutes to reflect. I thought we could popcorn style ideas. We'll try to capture ideas here. If you're more comfortable writing on a sticky note, we can post them up. But I want to give you a few minutes to think about those things and then just kind of have an opportunity for the group to share some of their thoughts related to this particular question. Ready? What do we know? Is everybody ready? Okay, yeah, we can start throwing out ideas. Yes?
From my personal experience, I know that students of a higher social class have better access to vape products because of their cost.
Okay, great. Yeah, in the back.
What I've learned is that the seniors get all of the vapes as well as the younger kids. If they ask for it,
And the older kids give them to the younger kids?
like at my school, like if they ask
Right.
for it, they will.
Okay. Yeah.
It's pervasive to kids that are hugely in junior high to 11-year-olds.
Right. Yeah.
It seems like there's a lot of social media about how cool it is, you can do little tricks with it, and the kids are very much attracted to that.
Right. Yeah, absolutely. Yeah.
Some of the retailers said that they have seen family members come in with underage youth and they buy products for underage kids.
Oh, wow.
In the store. I was surprised to hear that.
Wow. Yes. It's getting worse. I'm sorry. Other ideas, thoughts from other people in the room?
I think the school system doesn't know how to handle it too much.
Right.
The kids are way ahead of us in terms of figuring out how to hide it.
Absolutely.
And I also think those parents don't have a clue.
Right. Right. In terms of the actual device?
They're looking for a cigarette, and it doesn't look like that at all.
Right.
Yeah, let's pass it around. We've got a flash drive, a Juul, and a Juul pod. They're all empty. Well, I hope the flash drive isn't empty.
Yeah. Okay.
So, hold up, which is the flash drive?
So this is the flash drive. This is the Juul. This is the Juul pod. The cap comes off. And then the pod actually inserts here. So I'll let you explore all of these. And that is
I'm not sure I'm capturing this right. So parents don't know the products and don't know what to do, or was
They don't understand that it looks like a flash drive. They're expecting it to look like
A
an
cigarette.
e-cigarette or a cigarette.
right?
Okay.
Scanners.
Yeah. Great.
And that's what the retailer said. The retailer said that people came into their stores and the parents were buying them for them.
So do you think that there's some gap between the parents' knowledge of what these products are and what they do? Do you think that if the parents knew about the nicotine content and the potential health effects, they would still buy it for their students or children or not? Sorry, I was just asking Lydia and Tasmin if they think that the parents they know who are buying it for their children know about the nicotine content or the health effects or other effects, and whether they believe that if the parents knew of all of those things, whether they would still buy it for their children or not.
I would say the majority probably don't know about the health effects, but at the same time, some of them do. And they don't care.
Or they don't believe it.
Sure.
Or they think it's better.
Or they do.
Yeah.
They think it's basically the hype. It's
Healthier.
they're gonna do anything.
On a similar-ish note, what I've noticed is there's a disconnect. There is a lot of the parents who will be buying it, but there are also, like, the average Joe parent is completely not in the know.
Sure. Okay.
Like, I conducted interviews through my internship, and we talked about this with parents. Most of them didn't know what it was. So there's kind of a duality to that, where there are the parents who are buying it, and that's a large portion, but there's also a large portion that are not in the know.
Yes, thank you for that, yeah. Yes.
I'm guessing that some parents that buy it for their kids do it themselves, and it's like they think it's bonding.
Sure, yes, an opportunity to connect, yeah. Yeah. Any other thoughts?
Is this marketed as a way to stop smoking?
Are you asking if it's a way, is it being marketed that way?
Yeah, hasn't it been marketed?
Yes. Yes.
Not official.
Well, they do advertise it that way, but it is not an FDA-approved cessation device. So they do, they use that messaging. But
the retailers who came in to speak with the Lakewood, Healthy Lakewood, were insistent that they only carry their products to help people transition from tobacco to non-tobacco things, and that they're using it to save people from tobacco. And all of the retailers repeated that, and they said it numerous times. That was their approach as retailers.
Right. Awesome. Anything else? Any other thoughts? Great. Thank you all so much for sharing. So I think this shows that there is a lot going on around vaping. So speaking to my experience and our experience in our community, we have heard a series of things that are going on, including inconsistent enforcement, which creates some equity issues. We've heard that these products are easy to access, much of what has already been said tonight. We've heard that they can explode, and we know that we don't have a retailer license. So I think it's really important to note that these products really do create a problem every step of the way from cradle to grave when thinking about the impact that these products can have throughout the entire lifespan. So the next piece that I wanted to transition into is talking a little bit about what the data says. So this is from Vision, and this is 2015 data, so I want to preface that. 2017 data is available, and there are handouts in the back. Data has, the results from these particular two questions that I'm going to highlight, use rates have gone up a little bit, but not significantly. So just to orient you a little bit to this particular figure, along the bottom here are all the health statistics regions in Colorado. And then here's obviously a map of Colorado. And this line indicates our state average. And this question was about, this is high school students who had used an electronic vapor device ever. So who'd ever tried an e-device. And our Colorado average in 2015 here, I'm sure you cannot see this top, is 46.2%. But one thing that I really wanted to point out here is looking at the geographic differences and disparities that exist. So the darker blue indicates higher use rates, and the lighter blue indicates lower prevalence. So for 2017, we know we don't have, officially weighted Healthy Kids Colorado survey data for Jefferson County, but for 2017, about 44.6% in terms of ever use, and for Colorado in 2017, 44.2%. So we know that this is happening a lot, and it's happening all over the state in terms of who has ever used a device. And one other thing that's on a handout in the back is that the traditional disparities that exist with combustible tobacco use, we are not seeing with these e-devices. So disproportionately targeted groups or folks who were disproportionately using combustible products are not the same people that are using these devices. So just something to take note of. This particular table oriented very much the same, but this, again, 2015 data, we do have 2017 data. I will tell you those numbers here in a second. It's just not uploaded into the system yet. But this is current use. So again, high school students who currently use a vapor product, Colorado average in 2015, 26.1%. Again, you can see some geographic differences and disparities that exist there. So for Jefferson County, for 2017, for current use was 29.9%, and for the state of Colorado, it was 27%. All right, so that's a little bit of the data to ground us in terms of where we're going next. So again, I'm going to ask that we kind of participate in a group discussion and think about and really brainstorm what we can do about this particular issue. So I'm sure you've seen some Post-its up across the room. And I was thinking that we could divide up into groups and thinking about how we could potentially influence access to these products, how we could influence youth use, how we could influence storage and disposal, and then again, how we can influence media and marketing, all related to vaping. So there will be either myself or somebody from the Jeffco team at each of these groups to kind of write down all of your wonderful ideas. But I'm just gonna have you all kind of self-select in terms of maybe which topic area is of most interest to you. And then I will just ask that as we're doing this, maybe have somebody in mind that would be willing to report back out to the group with some of the things that you discussed. So I am going to give us about like 15 minutes, 15, 20 minutes to do this. So feel free to head to whichever Post-it looks of most interest to you, and then I'll bring us back together in 15 or 20 minutes. Sound good? Great. Scramble. All right. So I think we will go ahead and come back together here. And I was hoping we could start with our access group. Who was our reporter for the access group? Are you? Was it you? Great. You're coming forward? Sweet. Thank you. Yes, great idea.
So a couple of things we just talked about is licensing.
Great.
Raising minimum age to 21, and opposing opinion in the age of military. We want to educate parents more, just getting out and telling them really what's really behind all this. I think a big effect would be banning the regulating flavors, and because there's so many, and if we reduce to methanol, then that would be, I think that would put a huge stop to kids vaping. I think coding and enforcement, so just local, down parks, local areas, like within schools and in schools, around parks, playgrounds, just like areas that kids will be. And I think just really putting a huge enforcement on that, because it's not very strong right now. Enforcement, yeah, kind of restricting, kind of already said. Yeah. And then also ticket possession kind of goes along with being the restriction to the schools and stuff. So I think Golden and Lakewood need to just like be watching more, because they're actually, the city of Golden actually gives out tickets, which I didn't know, to kids who have possession. So I'm pretty sure, was it any of that stuff?
What?
Was it any of the, did you say, was it any of like was it like all flavors and stuff? Maybe no.
In Golden, what do they give write tickets for? Is that what you're wondering?
Yeah.
Okay.
For youth, when they get caught, but this is just in City of Golden, so.
Yeah, City of Golden.
Confusing for people.
Yes.
Great.
Ticketed for possession.
I see.
Yeah.
Awesome.
Yeah, so is there anything else anybody in our group wants to add?
Great job. Thank you. All right, let's move to youth use.
So, we were talking.
Yeah. Loud voice.
Alright, so we were talking about the youth use and how youth will self-explanatory. About how we should make it gross, make it so people think it's disgusting, how it should have an age restriction, like 21, and then they should have like reasons for use, like you think it's cool, you think what's happening in their life, and then like the risk, and about doing the drugs. And then I'd say maybe a more educational, like a video or something, where it shows like one person's brain versus another person. And if one of those people were to vape and the other one was not, like the effects over time. Finding replacements, like if vaping is caused by stress, like a stress level or something like that. Then some youth leadership, like peer education, like the parents engaging, the school-based interventions, which is another parent engagement thing, because and then environmental interventions, it's not safe for the environment either. And then, sorry.
With working with retailers.
Oh, working with retailers. Yeah, so like telling them that like they can't sell to kids under the age of 18.
Nice.
It's illegal. And then peer influence. We got is peer pressure.
Oh, great. Yay, wonderful job. Thank you. All right, maybe we'll go to media and marketing next. Do we have somebody who wants to share a few ideas from that?
I think that was
that was you?
Let's see. Anyone can jump in based on what we talked about. So the first one, I think, was also mentioned over here, but licensing retail sale. So making sure also that our language includes cigarettes and vapes is considered to be tobacco products. We talked about the height of advertising and limiting that, so making sure that things aren't being advertised kind of at eye level for people who might be younger than adult height, children and stuff, right? And then transparency around who funds the ad. So we talked about like how other places around Facebook were asking to know where the money is coming that's backing these advertisements. We'd like to see that on Facebook, YouTube, and other social media platforms. No billboards on highways and other areas, and regulate this. We talked about if tobacco companies want to claim vapes as a solution to quit smoking, they must go through the FDA to call this a cessation device, and go through those regulations. And then inviting local nonprofits to become involved, so to places like this, but then also to have input with the media. We talked about it's both important to look at media that's being marketed to young people, but also that's being marketed to adults, parents, and guardians, to make sure that everyone is really understanding the true harm and risk that's associated with vaping. Do you want to talk about the wrong page? So this could include some specific ideas and interventions that we came up with. We talked about getting in touch with consumer protection and really understanding who is monitoring. Getting in touch with physicians for responsible medicine, and then really looking at campaigns that focus on kind of a justice advocacy-oriented approach for young people and highlight these issues of injustice. Anything else to add, group?
Robin is going to share for our group for storage and disposal.
So when we were together, we had this extremely large group. It consisted of Brittany and myself, and then Jen came over. And I'm very naive about a lot of this stuff. And what I keyed in was when I heard the word lead. The lead is in these e-cigs, because lead in the environment never dies, and it creates a lot of problems. I mean, you can be very cognitively impaired if you are exposed to any kind of lead. So what we were talking about was that because of my naivety, we need to educate more. We need to really kind of promote why we're worried about this stuff being thrown on the ground and thrown in our yards and thrown into our wastewater. So we thought maybe there should be note on the packaging, which currently I don't think there is. And then I live in Urbana. And in my water bill, there comes out a monthly or bi-monthly newsletter. And they tell the community and people where they can dispose of hazardous waste. So like retailers like Ace Hardware, if you buy paint there, you pay a tax up front because it's considered a hazardous material. And if you have old paint laying around your house, you can take it to Ace. And they will take it to the hazardous waste dump. So we were thinking that maybe retailers could have a disposal area in their shop. If they sell it, they're responsible somehow to help people get rid of it in a safe way. So that's basically it. Oh, and then up front, you pay for paint, you pay for cans, you pay for an initial tax at the front end of the vapes when you buy them. And then when Jen said that these smokeless tobacco packets are being found all over the campuses and thrown in the street, and that's another issue.
Great job.
Thank you.
Thank you.
I'm stealing that idea.
I was just gonna say that, like, I feel like I have so many ideas that I'm so excited to take back to our community and see what we can maybe do with some of these. So thank you all. This was really great, and I think super helpful to think about all of the different ideas that we just have collectively in the room in terms of, you know, how we can potentially impact this problem. So thank you all so much for your great ideas. So this next piece that I wanted to move into just briefly, some of you may be familiar with this model, but this is the socio-ecological model, and looking at the layers that wrap around an individual, right? So we have interpersonal, organizational, community, and public policy. And we've got best practices for each one of these, and thinking about how we can really wrap around the individual to influence behavior. So this idea is about all of us working together and to make sustainable change and really behavior change at the individual level. So I wanted to take the opportunity really briefly to highlight an example of what we have done in Boulder County at the organization level. So we know that Jeffco has been working hard with districts for a long time, and this is something that we do in Boulder County as well. We oftentimes lean on our schools to guide and support young people. And this is oftentimes how place-based work happens. I will say, our districts came to us probably, last year, maybe about this time, or January, saying, we have a problem, we need your help. We don't know what to do. We've got kids using vape products all over the place. What can we do? So we took this as an opportunity to host a variety of parent nights. So co-hosting parent nights with schools. We had panel discussions as an opportunity to educate parents, students, and staff to really get this issue out in front of folks and really start by educating our community to talk about what we can do, what these products look like, how they work, etc. So through this process, we've also had an opportunity to create a website that hosts a variety of resources for our school staff, including teachers, admin, parents, students, that talk about the different layers of policy that exist within each of our districts. We have a variety of free lesson plans that can be implemented in the classroom. We have a lot of educational materials on there, but we really wanted to create something that was accessible to our district all of the time, something that they could reference as this issue continues to evolve. So just as a way for them to really feel like they had a place to go to get credible information. And so kind of as an extension of this year we've had the opportunity to work on a progressive discipline protocol or example with our district. So I'm not necessarily sure how your districts are structured here in Jefferson County, but our district is really decentralized. All of our schools kind of operate independently, which actually results in some inconsistencies around enforcement. So that's something that definitely came up for our district, which directly translates to an equity issue, right? So if one school is doing one thing and another school is doing something else, what does that mean? So we have had multiple conversations with school staff from multiple different schools to really try to build a core set of standards around how to address this issue. So we are in the process of looking at what a protocol could look like with our discipline team and thinking about how we can really address this issue the same across our entire district. So that's just a little bit about what we have done just as one example in Boulder County working with our schools. So to wrap up, I really just wanted to highlight that other things work. We know that there are other things that do work, and we oftentimes rely a lot on the community guide and looking at tobacco control and prevention best practices and some things that we can really do to influence the tobacco control world. And we hit on a lot of those things in our discussion, but that includes looking at maybe increasing the unit price for tobacco, looking at quitline interventions and expanding smoke-free policies just as some additional ways to really build out a comprehensive tobacco control and prevention program. So wanted to leave you with this resource, but now at this point, that is all I have for you. I wanted to leave a few moments, maybe not a few moments, maybe a couple questions for question and answers for me. Yes?
So in your county schools, you implemented this first-time offense, second-time offense, and third-time offense. Is that universally accepted in each of your schools now?
That is the direction that we are hoping to go. So right now we're having conversations with schools to try to understand maybe what they're already doing and how can we maybe use that first, second, third offense framework as maybe, you know, something to pull from, or can schools agree that yes, this is what happens on the first offense and yes, this is what happens on second offense? I think we just had really disparate things happening, right? Some schools are testing the liquid and some schools are doing Saturday school, right? Not to say one is bad and one is good, but it was just really across the board in terms of what was happening at each of our schools. Does that answer your question?
Yeah, it does. We have the same concern in Jefferson County because we decentralized all of our schools, and our principal has a school-based budget, and so they pretty much, you know, demand and determine how things go in school based on that.
Right.
And, you know, I was just trying to figure out if you went through the Board of Education or exactly how you got this implemented or trying to get it implemented.
So we've been working with the leadership team in our particular district, and it is actually a standing agenda item on our assistant principals standing meeting. So a lot of our assistant principals are continuing to have this conversation to figure out what are you doing here, what are we doing at another place, and how can we then, you know, bring these ideas to leadership team, or really how can we just keep the conversation going around decreasing inconsistencies? Yeah.
I was going to say, I mean, we're working on similar stuff in Jeffco with our legal department to create some guidelines around confiscation,
yes, awesome,
discipline, and that sort of thing. So
yeah,
because we do have a restorative approach happening in our district, so we are trying to move more towards sort of a level of discipline and also just complete accountability.
Great, thanks. Yeah.
I was very interested to hear about your district-wide website that's available, and I'm wondering if that's available to the public, because I love coming to these meetings and hearing what other districts, other groups are doing for tobacco control, and how do we cross-fertilize those resources and those approaches.
Yeah, absolutely. Yeah, it is available to everybody. It is public.
District website.
Yeah, it's actually hosted on our website, but when we communicate with district staff, or when district staff is looking for resources, that's really our landing page. And then we constantly update that with new information, etc. So then we can just kind of filter everybody to that same spot, and everything is free, everything is usable. We've got conversation starters, we've got lesson plans, we've got all sorts of education material on there, but just a way to really hold all of the things as you know things are changing constantly. So this is what it looks like. So really an education section, some laws and talking points, so highlighting what both of our district's policies look like, some lesson plans, and then additional resources for like alternative suspension, some advocacy opportunities, really just a place to hold all things school. Yeah.
So the FDA says this is an epidemic. Is the FDA doing anything?
Yes. Yes, they are.
They are.
We should talk about that later.
Yes. I do think maybe after, yes, we will chat after. There are some things that the FDA is currently doing, but I think there could be more to come, or an opportunity to do more. Any other questions?
I think it was a good point about making vaping gross. When I remember having health education, and they would show cross sections of smokers and non-smokers' lungs and things. They would have machines that would draw out a lot of smoke and filter it to show you what's going in and what like a tar looks like. And I'm not sure how to do that for vaping, because vaping seems to be something that's so appealing. And for us, to put a step from vaping to smoking to your lungs looking like that is understandable, but for somebody at high school, that may be very difficult to understand. So how to make it understandable that it's something that's gross is a bigger challenge. And I don't know how we're going to address that yet.
I agree with you 100%, and I think we think about that quite often. We've worked actually with a lot of students at CU to think about what's a marketing campaign to make this uncool, or how, oftentimes marketing students are like, make this sexy, make this cool, and we've come to them the last 2 semesters like, make this uncool, and it's a challenge, right? It's really hard to try to market something as not cool. So I think we sit with that a lot as well, and so I think that's a really great question to hold on to and for us to continue to think about as a group. Yeah. Yes.
To add on to that, I saw a YouTube video, and they had like a plastic bottle, like a Coke bottle, and they had cigarettes, and then they light them up, and then they would let it just burn, and then they had cotton balls in this, and so the cotton balls represented the lungs.
Okay.
So you would see it, and they had like they showed after one pack, and they were like black. The cotton balls were black, and so. That was really cool. That was a cool visual. I think that was a good way to show, and I don't know if that would work, but that's just a possibility.
Yeah, I think it's a great idea to hold on to. Yeah, we'll write it down. Yeah.
Stealing things from our neighbors.
We are.
Cross-fertilization.
Yes.
It's not stealing or borrowing, cross-fertilization.
I love it.
Thank you all.
Yes, thank you so much. I really appreciate getting to hang out with you all for the last hour or so. So thank you.
Hi everyone, my name is Allyson Howe. I'm stepping in for Donna tonight. I'm the Youth Engagement Specialist at Jefferson County Public Health. And I'm just going to take a few minutes right now to talk about different youth vaping education opportunities that are happening or that will be happening. And at the end, I'm going to be passing around some sign-up sheets. So if any of these things sound interesting to you, you're going to have the chance to write down your name and receive more information as we head forward. So in July, a group of concerned community members, school staff, and public health advocates met to look at strategies to address youth vaping. So a lot of these ideas have come out of those meetings. So I'm just going to kind of run through some of those. Our goal is to improve access to these educational opportunities to the general community, to school staff and administrators, to parents and families, to be able to help to intervene and support youth to prevent vaping. So one of those that we've talked about a lot today is that Jefferson County Board of Health passed a resolution declaring youth vaping a public health crisis. This is really important to help us to create a platform for broader attention for this issue. Additionally, at Jefferson County Public Health, our tobacco prevention staff are working hard to disseminate timely information via mass and targeted media campaign. Finally, let's see. we'll be offering various trainings. So this is something that might be of interest to folks, that these trainings will come in several different formats to school staff. So the goal of these is going to be to improve response to tobacco policy violations and to intervene effectively with students who are using or at risk of using vapes and juuls and other forms of tobacco. We're also exploring the feasibility of offering a training of trainers to conduct parent education workshops with the goal of helping parents, adults, other guardians in the community to be an askable adult around vaping. So this is something that's come up around really understanding the harm and risk involved and being able to have that specific training. Additionally, Jefferson County School Superintendent Dr. Jason Glass is working on a video PSA about vaping. So that's something that's going to be shared with Jeffco Public Schools, staff, parents, and students with the goal of educating and getting to many different people to talk about the dangers of these devices, the importance of the tobacco-free school policy adherence, and where to get other support around issues of vaping, including other information about what we know that might contribute to vaping use, including things such as hopelessness and anxiety. So now I'm going to pass around these different sign-up sheets. There are options for you to check off the different opportunities that you might be interested in. And if you have any other questions, feel free to ask them now. All right, great. So I have a few of these, so I'm going to send them down the rows and then I'll collect them at the end. Okay, thank you very much.
So this next part of our meeting is a very unique presentation that we have, and are so happy to have our youth co-chair, Tasmin Duncan, who has been so passionate about using her voice to advocate for change on topics that are important to her. So she has been exploring the world of civic engagement, and something that she put together is a how-to guide for young people to get involved in their communities and interact with policymakers and make their opinions and voices heard. And so Tasmin is going to present her how-to guide today, and I know we have some young people here today, so I'm hoping that you learn something, and she is great if you have any questions or want further support, and for the adults in the room, you can probably learn something too.
Okay, so we have civic engagement. It's this big, broad, and sometimes kind of scary term that's thrown out there. And we know that it brings change, but I know that a lot of people don't necessarily know what it is, especially people my age, and how to get involved. Where's that? Awesome. So what is it? Well, I have a definition up here. Individual and collective actions designed to identify and address issues of public concern. So what does that actually translate to in real life? Well, if you're over 18, you can vote. You can vote in elections, you can vote on laws on the ballot, and that can bring change. But if you're under 18, you're not completely powerless. There are things that you can do, and this takes the form of advocacy. There we go. So what is advocacy and what does it look like? What can you right now start doing? Well, local governments, such as city council. I specifically have experience with city council, so I focus on it in this presentation, but also the school board. Local governments are where you can affect change when you're my age. So you can speak at public comment. Anyone has that right to do that. And you can also approach city council members individually, and you can do this through board meetings, or you can schedule coffee meetings with them, and I'll talk more about that in a moment. So, public comment. It occurs at each city council meeting, and anyone at all who wants to speak is given about, in Jefferson County, it is exactly 3 minutes to speak. And you can talk about any subject or any issue that you have noticed that is causing problems within the community. It can also be a specific item on the agenda, and if it is, it will often have a separate time dedicated to it. But at every official city council meeting, there will be a public comment. So, how do you get started? Well, first you need to get onto your city's website, and you need to know when the dates are and what the agenda is each day that you want to go speak. So if you're planning on speaking at public comment, you might want to send emails ahead to city councilors. And what this does, it allows you to address any concerns that they have ahead of time, and it lets you get precursory or background information out to them ahead of time, which can really help given you only have 3 minutes to get a message out to people. So if the piece of policy that you are speaking on is on the agenda, as I mentioned earlier, there might be a specific public comment for it. So look for that, make sure you sign up for the right public comment. Also, since you will be signing up at the meeting, you want to be there early. I would say about 15 minutes early. Adult speakers, so 18 and older, you're going to have to leave addresses and things like that, key information, but if you are under 18, you do not have to do this. So, a lot of city council chambers are going to have a document reader, and this is really useful if you want to leave them fact sheets, or what I did is I brought pictures of Juul and vape products, excuse me, because a lot of those city council members had never seen that before. So you can bring documents that you prepare ahead of time for that. And also, if you want to bring little folders that have fact sheets, you can bring those and give those directly to city council members, but you have to bring an extra one for the county clerk. So make sure you have the number of city council members plus one extra if you're going to do that. There we go. So public speaking, this is everyone my age's favorite thing in the whole world. That was sarcasm if you couldn't tell. It's nerve-wracking. It can be scary if it's not something you're attuned to. It was scary to me, I'm not gonna lie. I was petrified as I walked up there. So here are just some little tips and tricks to make it just a little bit easier. So when you're planning a speech to give in front of a lawmaking body, one thing that you want to have is a clear ask. This is what you want them to do about said issue. What do you need to see changed? How do you want it to see changed? What do you want them to do? A lot of speeches will get flowery and dance around the issues. That's not something you want. You need to have them know exactly what you're asking of them. Also, every teacher from the dawn of time has told you to do this in your presentations, and a lot of people don't do this, but for city council and speeches regarding that, you need to use facts and figures from reliable sources, because this is the data that lawmakers are going to be using to make their decisions. So don't use .com or .info sites. Make sure you have good information. Go to public databases. Go to .org sites. Back up your facts. So, a lot of people think that city council members are just going to want the data. Give me the data, tell me the facts. And yes, facts are very important for this type of event, but they also are looking for the emotion. How does this affect you personally? Why do you care? The emotional aspect is so important because it shows that there is actually importance to the community and to people your age out there for an issue. So don't be afraid of it. This one I have big, bold, 3 times because it's important. You need to practice. Practicing a speech instead of winging it, one, allows you to figure out how much time you're taking up, because as I said, you do only get 3 minutes. but also it allows you to avoid embarrassing blunders that you could have in front of people. My specific speech, I practiced 14 times. And I'm not gonna lie, the first few times I went through it, not very good. So yeah, practice. And the last one. This is scary, especially when they're looking down on you from above in their haughty little upper balcony thing. But it is so important because it communicates that you care. You need to make eye contact. You need to look at them when you're talking. It's so much more powerful than just reading off of a fact sheet. So, etiquette, everyone's absolute favorite subject. So, dress for success is what I say. And you don't need to have an entire suit and tie getup. Certainly some people at the meeting I went to had that, but it's not necessary. What you don't want is to be the person who shows up with a ripped t-shirt and woolly jeans. That communicates clear disrespect. So dress nicely, dress in a way that communicates I'm here for business and I want to talk and be taken seriously. So, be polite and respectful. This should be kind of obvious, but it's necessary as well. It's the nature of politics that certain people aren't going to agree with everything that a lawmaker says or does. And you have a right to express discontent. You're allowed to, if you really want to, get up there and talk not very nice words about them. But do you really think they're going to listen to that? Do you really think they're going to care about what you're saying if you go up there and reprimand them and yell at them? No. If you are polite and friendly and respectful, your message is going to get heard much better than it would if you went up there and started yelling at them. And that's why that is so key. So, speak only when it's your turn. This one is a big, big thing at city council meetings. You have a 3-minute block of time. You do not get to exceed that 3-minute block of time. When it is your 3-minute block of time, you go up to a podium and you have 3 minutes with a microphone, and that's it. So, you have to make sure your speech is less than 3 minutes. I would say less than 3 minutes, because if you're at 3 minutes exactly, you're not accounting for the fact that there are nerves involved when you're talking up there. Also, once your time is up, they might ask you to come back up and answer questions for them. This happened to me. You are by no means to do what I ended up accidentally doing, and that is standing up and speaking from your seat. That is considered really rude. Don't do that. If they ask you to come back and answer questions, you walk up to the podium and you speak at the podium. So, only when it's your turn and only at the podium is what that comes down to, really. And this is so hard for my generation, and sometimes I don't understand why, but it is. If you're at a public function like this, you don't want to be like this with your little cell phone right in your face texting in the middle of the meeting. That doesn't look good. You also don't want your cell phone to go off right in the middle of the meeting, because that disrupts the meeting, and it's embarrassing. You don't want that to happen. So, cell phones off. So, just some examples of what to wear, generally more along the lines of business professional, and, well, the short answer is just to dress nice. Oh, not there yet. That's weird.
Wish we were more tech savvy here.
So, the coffee meeting. Despite the name, these meetings do not necessarily require that you have coffee. It's a term that is used for a short and informal meeting with someone, specifically with a city council member here. And what these do is these allow you to discuss an issue more in depth than you would at a 3-minute public comment slot. This allows you to interact with the individuals. And this allows you to give them a lot more information than you would have been able to do in that 3-minute slot. So these are important because maybe a city council member doesn't have all the facts when they take a viewpoint or a stand. This is the spot where you have more opportunity and more time to try to convince them of your viewpoint if they're against it, and to solidify it if they're with you. So, scheduling, every teenager's favorite thing. It's hard. City council members, they are very, very busy individuals. And these are real examples. They can be dealing with anything from rat infestations to tax reform. So they have very difficult, very busy lives, and sometimes it's hard to get a hold of them. Sometimes they'll have their inboxes flooded with hundreds of emails. So here's just some stuff that might make this a little easier. If you have a deadline by which you want to speak with them, like you want to talk to them before X meeting because X is being discussed at that meeting, you need to talk to them or send them an email as far ahead of time as physically possible if you want to see that deadline work out. So you need to be flexible. You can't, well, you need to be flexible, or you need to be okay with the fact that the meeting just might not happen. Because they have busy lives, they might be able to meet you at X street at X time, and that might not work for you. But you need to be open to not just after school at X time, if you can. If not, you need to be open to the fact that you might not be able to meet with them and look for an alternative form of getting in touch. So, that takes us to our next thing, have a backup plan. You might not be able to meet with this individual, and that's okay. What you can do is you can look at maybe doing a phone call visit with them, or maybe you send them emails and you correspond that way. Just don't expect that this meeting is going to happen no matter what. So, when you're requesting a meeting, you need to be formal. You're not emailing your best friend Bertha from X, Y, or Z. You are talking to an elected official, and you are asking them to take time out of their day to respond to you. So even if you don't necessarily agree with them, you need to be polite, you need to be calm, and you need to be respectful. And you probably don't want to appear desperate, so don't. Just be nice, be polite, and say, I was wondering if you could meet with me at X time. So, pick a location that works for them. You might not be able to have this meeting at your favorite coffee shop, and that's okay. You're looking for common ground to hold a meeting. And if they suggest something, you should seriously consider it. Yeah. So, etiquette. This is a much more informal meeting than city council chambers. You do not need suit or tie. You do not need really fancy or nice dress. In fact, you don't even need to be wearing a dress if you're a woman and doing this. This is, once again, not the place for ripped up jeans and ripped up shirt, generally, but you don't need to look super nice for this. So, you need to come prepared and with a purpose. If you say you want to talk to city council members just to talk, and you make sure that's known, that's okay. But if you schedule a meeting with them and you don't say that, they are expecting you to come prepared with a specific issue that you want to address. So know what you want to say before it comes. Have the fact sheets, have the data ready. So, be polite and shake their hands. These people are taking time out of their extremely busy lives to meet with you. So, if you have that meeting, you need to thank them for it. You need to shake their hands and say, thank you for meeting with me. This really means a lot. And also, on the idea of politeness, if you are going somewhere where you're eating, use table manners. It shouldn't have to be put out there, but I'm going to. And finally, the big one is agree to disagree. These meetings do not guarantee that they are going to see your side. At the end of the meeting, they may still be against what you're trying to say. That doesn't mean you start insulting them, or getting defensive, or angry. That's not going to change anything. At the end of the day, if you two don't agree, then it's fine. Agree to disagree. So some more what to wear. This is business casual, which is more or less what I propose for this. But also, you do you. I mean, be yourself a little bit more at these meetings. So, some more tips and tricks. Bring a notebook. If they say something important, write it down. If they have a question that you don't know how to address right then and there, write it down. Get back to them on that. Notebooks are great for that. Fact sheets. So, if you say something, like if I were to give you a bunch of facts about tobacco, you'd probably remember half of them. Maybe more because you're here right now interested about tobacco. But the average Joe would probably only remember about half of them, and even then for not very long. What a fact sheet does is it's permanent. It's in writing, and they can refer to it whenever they want. So it makes any data, any facts that you want to give them more pertinent. And finally, if they ask you a question that you don't know how to answer, do not panic. It's fine. Record it in your little notebook and get back to them via email. So, ward meetings. Right up there, if you want to know what ward you live in, you should be able to find that on the website for your city. So ward meetings, they occur each month, and you're allowed to go to the meetings of other wards, and you're not just confined to your own. So if you live in X ward, you're allowed to go to Z ward's meeting. These are less formal than city council meetings, but I would say they're a little bit more formal than coffee meetings. That said, at the ones I went to, I've seen people with strange vests and badges all over them to people wearing suits. So what level of formality you choose to wear is up to you. And so what these meetings do is they're a forum for city council members to address the concerns of the public, and for the public within their wards to make those concerns known. These are a great place if you have an issue that hasn't been on the city council's agenda, and you want to make it known. This is a great place to start out. So, to get information about these meetings, you need to go onto your city's website. You need to find out when they're happening. And it'll be under the government tab, which I will walk you through in a moment. So, you should also note that you do not need to sign up to speak. These are not like city council meetings where you have to come 15 minutes early and you have to sign something special to say your piece. Anyone can talk at these meetings. So yeah. So, city's website. This is Lakewood. I live in Lakewood, so I'm familiar with this website, so I'm using it as an exemplar. This is Lakewood's website page. Next, you go to the government tab, and there'll be all sorts of useful things, and you go to the city council if you are specifically looking at city council, and it'll have all the useful things that you need, including the ward map if you want to know what ward you live in. This is also where you get the information about public comment and those meetings. This is where you'll find information on ward meetings. This is a really good resource, in other words. Okay, so the elevator pitch. You have even less time at a ward meeting than you do at actual city council meetings to say something. If you want to make a point known, you've got to do it within a minute to 30 seconds, because that's all you're going to get. So this is where the elevator pitch comes in. So it's a 30-second to a minute, but mostly 30-second, proposal of what you want to see changed, how you would go about doing it. Basically, it's the bare bones of an issue. Here's some key information, here's the problem, here's a potential solution. This is not where you bring out every fact from here to kingdom come about the issue, because you don't have much time to do it. If you want to give them facts, bring an infographic or something like that, but the proposal itself needs to be short. Yeah. So here's some additional things about advocacy. So there's strength in numbers. It helps to be part of a group. I was part of the Citizens for a Healthier Lakewood, and they backed me with moral support, which was great for the public speaking aspects of this. But you also have the aspect of when you're in a group, people will notice you more because you're not one single person who has a grievance, you're many people who have a grievance, and that tends to be paid attention to. Next thing I want to emphasize, the youth voice gets heard. Not many people my age are really taking a stand on, well, anything, unless it's their favorite lipstick color on social media. So when someone my age gets up there and says, this is a problem, this is a change I need to see in my community, people listen because it's so rare. So your voice will be heard if you are willing to get out there. The second to last thing I want to emphasize is policy change takes time. You're not going to stand up in front of city council and give a speech and expect a week later for there to be a nice little law that's fixing everything. That's not how policy works. It can be up to a year, many years even, between when something is first brought to their attention to when an ordinance gets drafted to when that ordinance actually passes. It might not ever happen. But the main message there is be persistent, get back up there each time, talk more, make your voice heard more, and eventually the change will probably come. And the last thing, and this is something when I talk to city council members about what gets lost between communication between youth and them, that they mentioned, mind the generation gap. So what this is city council members tend to be slightly older individuals. They're not teenagers. They don't understand our lingo. A lot of them not so sure what a hashtag is, or YOLO, which are terribly old slang, but they're not going to get that lingo right off the bat. So if you're going to say something to them, you need to make sure that it's explicit, that it's clear, and that it's something that they can understand. And the most important thing, if you are going to get into this work, is that it is something you care about. Don't just do it because it looks good to colleges. Don't just do it because your friend said, hey, this is a thing. You need to be out there because it's something that matters to you. And we're excited, so do I have any questions?
Actually, I do. First of all, I think that was a really terrific presentation. And I felt your passion every second of it, so I appreciated that. You had a meeting with a city councilor, and I was just wondering if you could briefly say something about what that experience was like for you. Not like what happened, but just what was it like for you?
Well, it was kind of scary at first, but Councilor Franks is so calm, so kind. She was instantly in a situation where I felt comfortable talking to her. I don't know if it's going to be the same with everyone you meet with. I'm going to assume not, but don't expect that the person you're getting to talk to is going to be a monster at first sight, because they're not. They're a person. They're a nice person generally. It was, after the initial fear factor, actually really enlightening, because I was seeing the gears in the giant clock that is government turning, which, as someone who's somewhat interested in a political science major, is something that is very useful to me. So it was informational, and I felt like I was making a difference, because here was someone who was in a position of authority and she listened to what I had to say, and she was like, yeah, I agree with this. Nice. Any other questions?
What was your ask?
My ask was specifically for the tobacco retail licensing law that is pending in Lakewood to get passed, and just that she'll consider the information that I had to tell her about that kind of thing. Any other questions? Back?
I just want to make a comment that I fairly regularly attend city council meetings, and I've seen some people come up and speak about vaping, and especially I've seen some young people too, and they're always really well received. Like, you can just tell, I mean, sometimes there's some very controversial subjects, but everybody's very welcoming and very appreciative. I think when this subject comes up in particular, there's a lot of support from our elected officials, and they need to hear from everybody because they care about this issue and they can't take action on it unless they're hearing from people. I mean, it helps a lot to give them that, to just know that they're supporting their constituents and that's what their constituents want. So it's been very well received in Lakewood from my perspective.
Any other questions? Comments? Concerns? So I want this to be a resource to other young people, and I'm also going to see if I can present it at our first BET meeting. But yeah, Khanh actually has more details on how this, if someone needs it, would be distributed. But if any of you in this room want this presentation, all you need to do is shoot me an email. If you want that email, just come up and talk to me. Also, on the topic, and this is kind of going off the script a little bit, of civic engagement, the other youth in the room, Lydia, had an idea that she wanted to propose right now to this group, so.
So during Brittany's presentation, Tasmin and I started passing notes back and forth to one another about ideas of how we can involve more youth into the situation. And I'm going to be honest, you just don't really care that much, guys. It's unfortunate. But our idea was to take a different angle to fighting against the influence of tobacco against the youth population. And our idea was to create a type of art exhibit featuring sculptures, paintings, drawings, poetry, short stories, anything artistic that has to do with tobacco using teens. We're hoping to involve students in different districts, different schools, different ethnic backgrounds into this idea. We're not sure if we're going to be able to do it, and if any of you would be able to help us in any way, because honestly, we're just two teenage girls. We won't be able to do it alone. If you guys could help out, that would be incredible.
The idea behind it is it's another facet. There's posters all over the hall, plastered to the walls, that say that tobacco is harmful. Youth know that. But it's not working, because they're still vaping, they're still juuling. But maybe we should look at some avenues we haven't tried yet, like art, like stories, like things that kids my age actually would listen to. So I felt that Lydia deserved to bring that up.
Love it. We can do something about that. Yes, we can.
Thank you so much, Tasmin. And I think that was so timely, not just for young people, but for all of us in the room who care about anything that can be affected by policy change. I definitely took down some mental notes that'll help me the next time I talk to my council person. So we are approaching the end of our time together. The Tobacco Free Jeffco Alliance, a lot of our regular members are here today. I see some new faces, and we'd love to have you join and keep coming back. But this piece is a little bit one more geared towards regular members, just in the sense that they kind of knew that we had this process going on this summer of planning out our priorities for this group for the next
3 years or so. And so our strategic planning core group got together and just defined our mission, vision statement and about us. And this is just us sharing out what was decided as well as the priorities for the next few years. So this is actually great even for people who are not regular attendees to this meeting, because if any of this speaks to you, we would love to have you keep coming. So our mission is empowering people and communities to reduce tobacco-related disease, death, and disparities in Jefferson County. Our vision is that individuals and communities commit to action for the health and well-being of all people. And, you know, we do that by preventing and reducing the use of and exposure to tobacco products in all forms. And as a result of our work, our efforts save lives and help reduce the financial and social burden caused by tobacco in our communities. And the priorities that were identified for the next 3 years of our work are youth prevention, communication, improving communication, continuing to promote cessation resources, and policy work. So that is always going to be one way that our alliance members and partners attempt to affect change and really make a difference in our communities around tobacco use. And yes, any questions about any of this, comments? Do current members or potential new members have any suggestions or thoughts or? Yes.
I just wanted to respond to the idea regarding the art exhibit.
Oh, sure, of course.
So you may already be aware that there's a national art contest that happens every year called Reflections. And it's in elementary, middle, and high schools, and there's a topic that's connected to it every year, and it's for visual art, photography, literature, people can write music, create movies. It's like 6 different art forms. And every year there's a different topic. This year the topic is the heroes around us. If the people that create the Reflections program were flooded with lots of people saying, hey, the topic next year should be anti-vaping messages or something like that, said more eloquently, then maybe that could affect not just people locally, but across the nation, kids.
Thank you.
So if you look it up under PTA Reflections.
Yes, we can look into that and bring it to our coalitions and the youth teams as well. There's just one more thing, and our co-chair is going to send you home with a call to action.
So tonight, and this great presentation that Brittany did tonight, what were a couple things that you heard, commonalities about what we could do? So I heard like 2 main things in the media marketing. It's the umbrella. What is the umbrella under licensing? And every person here can assist with that by making your voices known. There's another big piece to this too. We don't know that vaping is a big issue, and we need to raise this up. So the other piece is education, and I would say that almost all of the stuff that's on the walls would fit under those 2 pieces, both licensing and education. So what can you do? We need to start talking about it. We need to start talking about it seriously with kids and come up with good ways to respond to their protests about how okay vaping is. So if you've got teenagers, please do that, or younger kids, because it's happening in middle school now. There's lots of resources that Jefferson County Public Health puts out. Visit the website, please, and access them.
I know that we have Pediatrics West here. Are there some fact sheets that you could put out in your office to get people talking about this?
Well, and just in the last 6 months to a year, the American Academy of Pediatrics is coming out with a lot more. I'm a certified pediatric nurse, and we have had more education modules and everything in regards to vaping, cigarettes, and so that knowledge is getting out. And it's just now going across our EMR, which is our medical record, and adding that in to make sure that that's under the tobacco questions that we're asking. Because routinely, that hasn't been going together with that category for a long time. And they're just changing that across our EMR now.
When you ask a teenager, do you use tobacco? They're vaping, they're probably going to say no. So vaping and tobacco are the same. And I know when my kids were little, we used to always get those worksheets and handouts when we did our pediatric visits. So there's lots of opportunities to spread the word. We got to do it in social media, not on Facebook because teenagers don't really use Facebook anymore. So there's got to be other social media approaches as well. So help us with that. Citizens for a Healthier Lakewood. We are doing something about tobacco licensing. We are making our way through the civic process. Tasmin was so right about it taking longer than a week. I think we've been at it, about a year and a half now? Maybe longer with Lakewood. We are going to have a meeting on September 25th where we're going to talk about, just briefly, about testifying and speaking at the October 1st City Council meeting, so please be there for that. But the other most important thing is that we're also going to be talking about health in Lakewood. There's what is it? It's a report.
The city planner is sharing the community needs assessment.
Right, on what's happening in Lakewood. So anybody here live in Lakewood? I do. Please join us for that because good health is not just about tobacco use and vaping, it's really the whole thing. So we'll be talking about that. It's September 27th, just 5 to 7. Just an hour of your time. Youth, be like Tasmin. And then we have some exciting stuff going on in Jeffco Public Health for the vaping classes and the education classes that we are going to be promoting for teachers and staff. So please help us. Did Rhonda already leave? Yeah, she left and help be a trainer. So please help us get the word out and make a difference.
Thank you for coming.
Yes, thank you all for coming.